Susie. I'm from Wales in the UK, and I saw that the professor advertised in Cardiff for the Nord Clinic, so I was very interested. So then I saw the Facebook group and I joined the Facebook group, and I just looked at everybody who said they had an amazing time here. So I looked into it, contacted the clinic, and it went on from there. I had a car crash in 2017 and arthritis is set up behind the kneecaps from that point. It's just got worse over the years, to the point at which I don't trust myself to go out and walk very far in case I can't get back because of the pain. So that has absolutely driven me to look for somewhere to have a knee replacement, yes. Very excited about the robotic assistant knee surgery. Agne, who I was in contact with, she told me that it was available and would I be interested, and I said 100%, absolutely. Cutting edge of technology, you know, and I think it's going to be really advantageous for recovery. So that's really what I'm looking for. Well, I've got a dog who I haven't been able to walk, and then running around with my grandchildren because I haven't been able to do that either. The clinic, Nordic Clinic, has been absolutely fantastic. Very clear, very quick replies to emails, lots of help where to go for an ECG or X-ray in the UK, so really good from start to finish. The professor talked about the robotic surgery and how it would be a cleaner surgery and that it wasn't so much interference with the knee, so therefore recovery should be quicker.
While we use a robotic system ROSA, we implant special trackers into the tibial bone, also in the femur. Those trackers cooperate with the camera, and based on the measurements during the surgery, the robotic system calculates all the anatomic parameters of the patients and puts all the cutting blocks exactly in the right space where surgeon eventually does the bone cuts, and this helps to restore the anatomy the best possible way for the patient. If we perform surgery using robotic system ROSA, it has a much higher chance that patients will feel better, their knee will function better, they will have better range of motion, and implant longevity will be longer as compared to those knees which are done using conventional approach.